Have you ever felt an uncomfortable itch on your wrist, only to discover a painful rash lurking underneath? You're not alone. Rashes on the wrist can be annoying, frustrating, and sometimes even alarming. In this lecture, we will explore the many faces of wrist rashes, their causes, symptoms, and the best ways to treat them. Rashes can be red, itchy, bumpy, or even blistering. They can appear seemingly out of nowhere, often leaving us scratching our heads and wondering what went wrong. While most rashes are harmless, some may signal underlying health issues that require attention. Understanding the characteristics and triggers of wrist rashes can help you take action and seek the right treatment. What is a rash? A rash is a noticeable change in the skin's color or texture. It can be localized to a specific area, such as your wrist, or spread across larger parts of the body. Rashes can take many forms, including red spots, bumps, blisters, or even flaky patches. Depending on the cause, they can be itchy, painful, or irritating, impacting your daily life and overall well-being. Common symptoms of wrist rashes. When it comes to rashes, the specific symptoms can vary widely. Here are some common characteristics that might help you identify what's happening on your wrist. Redness. The rash may appear as a patch of red skin. Itchiness. This can range from mild irritation to intense itching that disrupts your daily activities. Bumps or blisters. You may notice raised areas filled with fluid or spots that seem to be bubbling. Swelling. The affected area might become puffy or inflamed. Oozing. Some rashes can weep clear or yellow fluid, indicating irritation or infection. Pain. Rashes can sometimes be painful, adding to your discomfort. Causes of rashes on the wrist. Rashes on the wrist can arise from a variety of sources. Understanding the potential culprits can empower you to make informed decisions about treatment. Let's delve into some common causes. 1. Allergic reactions. Allergic reactions are among the most common triggers for wrist rashes. You may develop a rash if you're sensitive to materials or substances that come into contact with your skin, such as jewelry. Nickel, often found in watches and bracelets, is a notorious allergen. If you've recently worn a new piece of jewelry, it could be the source of your rash. Detergents and soaps. Some laundry products can irritate the skin, leading to a rash after wearing washed clothes. Plants. Poison ivy or poison oak can cause a rash if you touch them and then touch your wrist. When your skin reacts to these substances, it can lead to allergic contact dermatitis, resulting in red, itchy bumps or blisters. 2. Eczema. Eczema, or atopic dermatitis, affects millions of people, causing patches of dry, red, and cracked skin. This chronic condition often appears on the wrists and other areas of the body that are prone to friction or contact with environmental elements. Eczema may be triggered by stress, allergens, or weather changes, and while it can be persistent, proper management can reduce its impact on daily life. 3. Reactions to medications. Sometimes, the medications you take can cause unexpected side effects. A rash can appear if you are allergic to a drug, leading to a drug eruption. If you suspect a medication is causing your rash, it's crucial to consult your doctor immediately. 4. Lichen planus. This non-contagious autoimmune condition causes small, itchy, reddish-purple bumps on the skin. Lichen planus can occur anywhere on the body, including the wrists. While its exact cause is unclear, managing symptoms can help alleviate discomfort. 5. Scabies. If you notice severe itching and tiny bumps on your wrist, it could be scabies. This highly contagious condition occurs when tiny mites burrow into the skin, leading to intense itching. Scabies can spread quickly, especially in crowded living conditions, so it's essential to seek treatment promptly. 6. Viral or bacterial infections. Various infections can lead to rashes, including viral illnesses like chickenpox or bacterial infections that may manifest as a rash on the wrist. In many cases, the rash will resolve as the underlying infection improves. However, if a rash is accompanied by fever or other symptoms, it's crucial to consult a healthcare professional. 7. Rocky Mountain Spotted Fever. This tick-borne illness can cause a splotchy rash that appears a few days after a fever develops. This serious condition requires immediate medical attention, as it can lead to severe health complications without treatment. Diagnosing the cause of a wrist rash. To determine the cause of your rash, a doctor will likely conduct a thorough examination. They may ask questions about your medical history, recent activities, and any new products you've used. Here's what they might look for. Signs of blisters or sores. Changes in your routine, such as using a new soap or wearing new jewelry. Outdoor activities that could expose you to allergens or ticks. Recent medication changes. In some cases, a doctor might recommend skin tests, biopsies, or blood tests to help pinpoint the exact cause of your rash. When to seek medical attention. Most rashes are harmless and will resolve on their own, but certain signs should prompt you to seek medical help. Fever. If you develop a rash along with a fever, it's essential to contact a doctor. Rapid spread. If the rash spreads quickly across your body, that's a red flag. Open sores or blisters. If you notice these developing, it's important to get checked for infection. Sensitivity. If the rash causes discomfort in sensitive areas like the mouth or genitals, seek help. Symptoms of Rocky Mountain Spotted Fever. If you have muscle pain, nausea, or other severe symptoms after being outdoors, see a doctor. Treating wrist rashes. The treatment for a rash on your wrist largely depends on its cause. Here's a quick overview of some common treatment options. Self-care treatments. For mild rashes, several self-care methods can help relieve symptoms. Cool compresses. Applying a cool, damp cloth can soothe irritation. Calamine lotion. This over-the-counter remedy can help alleviate itching. Oatmeal or baking soda baths. Soaking in these can provide relief for itchy skin. Antihistamines. Over-the-counter antihistamines can help reduce itchiness and swelling. Prescription treatments. If the rash is severe or not improving, a doctor may prescribe stronger treatments, such as prescription antihistamines, for more severe allergic reactions. Corticosteroid creams, to reduce inflammation and itching. Antibiotic ointments, if an infection is present. Oral corticosteroids, for widespread or severe cases. Phototherapy, for chronic conditions like eczema or lichen planus. Biologics or immunosuppressants, for long-term management of autoimmune conditions. For serious conditions like Rocky Mountain Spotted Fever, early intervention with antibiotics like doxycycline is essential. Living with chronic rashes. For those with chronic skin conditions, managing wrist rashes becomes an ongoing process. Consistent self-care through regular cleaning and moisturizing can help keep your skin healthy and minimize flare-ups. If you have a medication-induced rash, symptoms typically resolve after discontinuing the drug, but it might take a few days for the rash to improve. Conclusion. Rashes on the wrist can be more than just an annoyance, they can signal underlying health issues that need attention. By understanding the causes and symptoms of wrist rashes, you can take control of your health and seek the appropriate treatment when necessary. Remember, while most rashes are harmless, paying attention to your body and knowing when to consult a healthcare professional can make a significant difference in your well-being. If you're dealing with a rash on your wrist, don't hesitate to seek help. With the right knowledge and care, you can effectively manage your symptoms and get back to feeling like yourself again. Thank you for joining me today to learn about this important topic. Stay informed, stay healthy, and take care of your skin.